Hi, everyone. This is Yasmina Sisrak. I'm your host and the presenter of today's webinar, along with Kristen Kroc. Welcome, everyone. I hope everyone can hear me okay. Today's webinar is our 10th webinar in our COVID-19 webinar series, which is presented by the HealthMatters program in the Department of Disability and Human Development at the University of Illinois at Chicago through continued partnership with Project Search and their funding from the Ohio Developmental Disabilities Council in collaboration with Aspire Community Services in Illinois. Today's 10th webinar is going to be talking about Virtual Coach, how we translated our HealthMatters 12-week program, which is a health promotion, health education program aimed specifically for individuals with intellectual and developmental disabilities into an online virtual training. I wanted to just briefly introduce Kristen. Do you want to just say a few words, Kristen?
Hi, thank you, Yasmina. My name is Kristen Kroc. I am the Life Enrichment Director for a community-based organization called Aspire, which is in 2 different counties in Illinois. I've worked with Yasmina and Beth Marks at UIC for close to 14 or 15 years. And so I'm really excited to talk to you all today about the virtual program and what it's offered us at Aspire. Thank you.
Thanks, Kristen. And you'll be hearing more from Kristen in a little bit. I also wanted to introduce my co-director of the HealthMatters program, Beth Marks. Beth, did you want to say something? Beth?
Hello, everyone, and welcome. Thank you for joining us today.
Thanks. Thank you, Beth. Beth is going to be acting as a chat box and question and answer monitor. So if you have any questions, please make sure you put them to all panelists. That way, she's able to view all the questions and track them and be able to post them for us at the end of this presentation. So I want to make sure we're not missing anything. If it's just coming to me as a host, it's going to be a little bit difficult to monitor the chat boxes. So thank you. Again, we are recording this webinar, and we will make everything available within a week, PowerPoints and any other information that you need. As I just wanted to briefly touch upon what is HealthMatters. I think many of you are familiar with HealthMatters program, but we provide health promotion research and project management and development of health promotive programs for individuals with intellectual disabilities, and specifically work with community organizations and individuals themselves. We also provide training, curriculum development, and instructional design. We also provide consulting and program evaluation. We have participated or sort of helped out numerous community-based organizations to write their grants that are aimed at health promotion programming within their organizations. We are located at the University of Illinois in Chicago, and most of our grants are federally funded grants. So a little bit about what we do in the programming. So the goals for today are to really just some of you who may not be familiar with HealthMatters program, describe our evidence-based program, the way it was tested and created and developed. Then I wanted to demonstrate Virtual Coach HealthMatters program in Google Classroom. So I will share my screen and just show you how it looks. And then Kristen is going to report lessons learned from a pilot project at Aspire. She has had several group homes participate in this newly developed way of doing virtual health promotion programming. So she will share their lessons learned and sort of give you some tidbits about how their program is going. And then lastly, we wanted to provide you information on how you can utilize Virtual Coach HealthMatters program in your organization. And we'll talk a little bit about that. So our HealthMatters program has 3 components. It has a training, which is an online webinar training that certifies direct support professionals or any managers or anyone who are supporting people with intellectual and developmental disabilities in communities. This webinar is always 6 hours, and it's usually administered over 3 days a week, 3 days for 90 minutes, and then there's 90 minutes offline work. And that gives you, for those of you who need continuing education credits, it gives you 6 credits. Also, what we've done, we've actually managed a couple of weeks ago to run this webinar in one day. So it was actually, I think we're all building pretty good stamina and doing this virtual programming and training. So we were able to run it successfully with one organization in one day. The second component of the program is the curriculum. It's called the HealthMatters Exercise and Nutrition Health Education Curriculum for people with developmental disabilities. This is also a evidence-based curriculum that was tested and developed during one of our research studies. And the third component is the actual running of the 12-week HealthMatters program with individuals with disabilities in the community. So the program, the way it was tested and evidence-based, is run in 3 1.5 to 2 hour sessions per week. So 3 times a week for about 2 hours for 12 weeks. So total 36 lessons, which have specific topics. This program is run by staff or individuals who support people with disabilities and who are certified or have attended our certified instructor webinar. So that's a little bit about the 3 components, just to kind of clarify it, how it looks. So the training and the program, the certified instructor webinar the goal of that webinar is to teach staff to implement the 12-week HealthMatters program, a physical activity, exercise, and health education program, and learn how to use the curriculum and engage people with intellectual disabilities in being physically active and sort of take charge of their health and improve their health education. Additionally, the goal is to teach core concepts that are related to physical activity and nutrition and support people with intellectual disabilities to incorporate physical activity and healthy lifestyles into activities of daily living. And then we also teach the staff to evaluate and sustain the program. The 12-week HealthMatters program aims to improve health behaviors and health status of people with intellectual disabilities, and then provides access to healthy lifestyle opportunities where people with intellectual disabilities live, work, learn, and play. So a little bit of just description. The curriculum, which actually is a standalone published curriculum, and you can find it, you can get it on Amazon, is divided in 36 interactive lessons over 5 units with 23 additional lifelong learning lessons. And all of these lessons were essentially developed with individuals with intellectual disabilities. So a lot of the topics, specifically the 23 additional lifelong learning lessons, were developed when Beth and I worked in community-based organizations to deliver this 12-week program years ago. And the goal of these lessons is to understand attitudes towards health, exercise, and nutrition, identify current behaviors, develop clear exercise and nutrition goals, and be able to kind of keep up and stick with them, and then gain skills and knowledge about exercising and eating nutritious foods, and being able to support each other during the class. Now, when you're looking at this program, it is a group program. We always recommend 6 to 8 participants. Now, this is going to look slightly different when you're doing it during COVID pandemic. So this is what Kristen is going to be talking about in a few minutes. So how did we, or when we went into shelter in place in March in Illinois, mid-March, one of the questions one of the worries that Beth and I had was now the health promotion programming for individuals with disabilities is just going to disappear because all of these organizations have to kind of rethink other services who they may come first before health promotion programming. However, we received numerous calls from different organizations across the country asking us, how can we promote health during COVID-19 pandemic while people are sheltering in place? So this is where we really decided to really think about how are we going to deliver resources, training, and materials via electronic media, and being able to rapidly transfer what we know to people that need it the most. And then how can we share evidence-based programming and being able to scale it up and disseminate it utilizing these e-learning platforms that were available and easy to use, and be able to take advantage of multimedia interactivity and sort of the feedback that online can really, we can utilize online. At the same time, in April of this past April, internally at the University of Illinois Center for Clinical and Translational Science issued some pilot translational and clinical studies programs. We request for proposals. It was a small grant that we were able to apply for, and we were awarded the grant. And it's a one-year grant which started in June 1st. And there were two essentially sort of aims that we were wanting to reach with this one-year grant. One was to identify issues with individual system and organizational level responses and equity arising during the COVID-19 pandemic, with a rapid preparedness and response survey for organizations that are serving people with intellectual disabilities. We will hopefully be able to share some of that data a little bit later, hopefully in a month or two, with you guys. And the second piece, which we're really focusing on, is to create this virtual coach HealthMatters Google Classroom and test the effectiveness of e-learning health promotion program. And this is what we will be focusing on today. So with the virtual coach HealthMatters Google Classroom, our aim was to support frontline staff to deliver health promotion programming for people during COVID-19 pandemic. Again, our goal is to do it as a 12-week program with hopes that people can do 3 lessons per week. We'll talk more about that in a second. And then everything that I've talked about the curriculum is a culturally appropriate, easy access, online, anytime, anywhere, educational modules and messages and videos to really improve health and health promotion, and increase physical activity and movement during this time. And obviously, we would be using, or we have used, multimedia interactivity and that integrated feedback. So why Google Classroom? We really had to figure out a really quick way to do this, and we're not huge technological experts. We're researchers, and we're trainers and program developers. So we decided to really take a look at Google Classroom. And it was free. It really was the ease of Google Classroom. The reason why it was so attractive to us is because you could streamline communication and workflow for users by providing a single access point to discussion, threads, and assigned lessons. So what that means is there is a lesson, and then if one of the group homes is working on a lesson and they hate the video, or they want more information about a specific topic, or they have a question, they can post it in a designated chat spot and then it would come to me or come to the instructors of the course, and we can almost in real time answer these questions and help them out. So this was kind of a cool way of being able to being connected while we were sheltering in place. So it is interactive. There's that real-time feedback and communication, which gives ability to improve materials instantaneously, and then it promotes collaborative learning. So we're really listening to our community members and trying to make things better. It is fairly easy to use. You still need a bit of practice, and Kristen will talk about that. And then it saves time. Everything is in one place. So if you have the login and you figure out how to get on the Google Classroom, you are able to do your lessons. Everything is in there. And it's flexible, and then it's mobile friendly. I think before I pass the presentation to Kristen, and she talks about a little bit about how they piloted it at Aspire, I just wanted to share my screen and just show you how it looks in a Google Classroom. So Kristen, let me know if you cannot see this. So essentially, I'm sharing my Google Classroom space, and if I click on the classwork, this is essentially the HealthMatters 12-week program and the curriculum that you can utilize along with the curriculum book. So this gives you all of the lessons that are already in the curriculum. I just wanted to give you one sort of like a little snack of how one looks. So lesson number 23, for example, is nutrition plan, making a menu. So there's a couple of activities. And there is a let's move. So if you go to the first activity, we found some videos to explain different concepts, and then people can there's activities that are very much visual, and then they can spend time with their staff discussing. In this particular lesson is thinking about what foods they should be eating more, which foods they should be eating less, what are their favorite snacks, etc. The Let's Move part always has about 15 to 30 minutes of different types of exercises that really use almost just your body and a lot of them are, a lot of participants liked dance videos, so I've been incorporating a lot of dance videos, and then they've been really into yoga because there's a lesson on breathing correctly and sort of breathing during stress and those kinds of things, and they really enjoyed those videos, so people want more yoga. So I'm able to find and sort of approve the yoga videos. Now, this is trial and error. It's not perfect. So some videos people really hated, so we have to go back to the drawing board and change them and see and get their responses again. But this is, and then there's just do this last. Basically, what do you think of the lesson? Great, just okay, boring. And then do you have any questions or tell me more about how to make it better? So that's basically one lesson or how each lesson is structured. So there's sort of three pieces. One is the education piece, the exercise or physical activity piece, and then evaluation will give us feedback how to make it better. All right. Let me see. Beth, are there any specific questions that I can answer now? No specific questions. So, all right, I'm going to pass the presentation to Kristen, and she's going to talk about how they piloted and operationalized this virtual program at Aspire. Kristen?
Perfect. Thank you, Yasmina. Hello, everyone. Welcome. I'm going to do just that, exactly what Yasmina said. And if you can't hear me, Yasmina, please let me know. I wanted to give you some background information about our setting and Aspire and kind of what we're all about. Aspire was founded in 1960, and we are recognized really in Illinois and Wisconsin as a leader with really bold and enterprising initiatives. We're very proud of the things that we have initiated and created for the individuals that we're supporting in Illinois and Wisconsin. And we provide services to children and adults with developmental disabilities, their families, and their communities, because we're all working together to help support the individuals that we're working with. We have about 200 team members and serve about nearly 1,000 individuals per year. And some of our programs include our community day services, so our life enrichment programs, which are really our day programs and are designed to help individuals pursue and to build upon activities that they find meaningful, that are enriching, that are interesting to those individuals. We also, within our community day services, have a career academy. And our career academy is really focusing on a variety of fields and professions in different industries. So the environment is set up in pods, if you will, and those pods focus on a variety of professions or industries that individuals could seek out employment for, including hospitality, jobs in the culinary profession, offices, businesses like that, and then lessons and curriculum are developed around those enterprises and those businesses and facilitated to individuals. Aspire also has living programs, which include our residential programs. We have close to 21 community integrated living arrangement homes in communities in Cook and Lake County in Illinois. We also have a program called Life on My Own, which is an independent living program, so really helping individuals who are focused on having their own home and building upon the skills and the skill set that they need to get to that goal. Aspire also has clinical services, so we have a clinical team that help individuals work through mental health issues and support. That department has art therapists, and they serve individuals who have a primary diagnosis of mental health, but also individuals that we're supporting with IDD who might have a dual diagnosis. And then also an employment services, so helping individuals within our Aspire program find employment, whatever that looks like for them, but also working with the Department of Voc Rehab on their referrals to our Aspire program for that. So our capacity at Aspire to implement this virtual coaching opportunity is a little bit different than probably most. I want to say that Aspire last summer, North Point, which is an organization that I worked for about 14 years, we joined the Aspire family in August of 2019. So yay, it's been about a year. We're super excited, and really together we found that we are better. We knew that going in prior to our joining the Aspire family, but that has proven true this last year, especially with just COVID and the pandemic. So Aspire has programs in both Cook County and Lake County, Illinois. And North Point, before joining the Aspire family, has previously partnered with UIC and Beth and Yasmina and the HealthMatters program for over 15 years on a variety of grants, programs, opportunities, trainings. It's really been a huge part of North Point's culture, and we knew, again, going into joining Aspire that was going to be built into all of Aspire, and we would build that in to the different programs and opportunities that we offer. So for Aspire's HealthMatters program, we received a grant in 2019 to do just that, to implement and to integrate HealthMatters program into Cook County, because it was already ingrained in Lake County. So we trained staff in Cook County in February of 2020, this past February, and we were due to start the 12-week HealthMatters program in literally mid-March. And we all know that, effective around the country, different shelter-in-places went into effect. And here it was March 16th in Illinois, our shelter-in-place went into effect. And, of course, all of our community day services and programs and HealthMatters were at that point put on hold. So very quickly, like everyone else, we had to adapt and change and do what we needed to do to continue providing programming and support and opportunities for individuals. And so Aspire's virtual program, what we're kind of doing now, really that planning really began immediately. And we began offering virtual programming to our residential homes in early April via tablets and Zoom. So we made a decision to have tablets that were purchased, and each home has access to one, and that's how our individuals are accessing Zoom and our virtual programming. So we then communicate with Yasmina and Beth all the time, and the opportunity came up to kind of learn about the Virtual Health Matters program, to be a part of it, to help develop it, provide feedback. And so we started the program, the Virtual Health Matters Coach program, in May of 2020 through Aspire. We've kind of had and learned we've had two different approaches per counties, and have found that that's been okay. And it didn't happen, we didn't plan it that way, kind of just developed that way. We've worked with it and made it work for the homes in different counties. So in Lake County, which is where I work and where my life enrichment program is at, we're doing an in-person virtual coach. So what that means, how we're defining that, is that, remember, North Point, Health Matters was already part of our culture and part of our programming. So I already had staff who were trained in the Health Matters program. I have 2 houses that we identified in Lake County that are piloting the program, and I have staff who are supporting those houses daily who are facilitating the virtual program. So those are DSPs who were previously trained. They're currently in a house supporting during the week, and they are the ones who are facilitating that program to individuals in the home. So it's in person. It's virtual via Google Docs, but it's in person. In Cook County, we had trained certain staff. We had planned to begin the in-person class in March, but we couldn't. So we had not had the opportunity to implement the program in person in community day services. So we also chose 2 homes in Cook County to pilot that virtual pilot the virtual program, and we knew right away, based on our staffing patterns in Cook County, that we were going to need to have the facilitators of the virtual program be remote. They had been trained, but they weren't, based on staffing, in the houses that we thought at that point would be the best fit for the program. So I hope that makes sense. The staff were trained to teach the program, but they weren't directly supporting the houses that were piloting the program. So initially there were some road bumps, if you will, some hiccups in making that work. We did kind of change out the staff a week or 2 in because we found that it was just going to work better again with particular houses and staffing patterns. So in Cook County, the facilitation is coming remotely. The person who's facilitating that program is logging into Zoom with the house, and they're doing the program remotely. What that means in regards to the difference for Lake County, the program is still moving forward. We've still had really good feedback and success. It's just a different way to facilitate the program, and I don't think that there's one way better than the other. It's just kind of how it worked out, and we're going with it and making it work. I didn't mention, though, how many participants in each house, so let me do that. In Lake County, I mentioned I have 2 homes. We have 12 participants and 2 staff. So those 2 staff are each in one home, a total combination of 12 participants for the 2 houses. In Cook County, we also have 2 SILA homes, residential homes. There's 1 staff who is remotely facilitating to 2 different houses with about 10 participants. But interestingly enough, in Cook County, there are other houses that are joining the program too that weren't initially part of the pilot program, but they have an interest, and so they're kind of just joining in when they can, which is exciting. As Yasmina said, the lessons really are great for how she's incorporated, her and Beth have incorporated the feedback that can be directly provided. So there is a lot of interactive resources to use, a lot of videos, a lot of hands-on things, but it's also really great right then and there for the staff and individuals to provide feedback that goes directly to Yasmina. We can then respond to questions in a timely manner. We can provide additional resources. We met last week collectively as a group and learned that one house was really into nutrition. They wanted to know more about certain components of nutrition. So we really brainstormed right then and there, and those resources went out to the houses this week so that they can continue that discussion. We're also finding it really important once a unit is done that we're having some format of like a monthly check-in so that we can review progress. We can brainstorm. We had a really great session last week where we got a number of ideas from staff about kind of how to approach things. So it was really important, I think, that that component be built in. I think it's a really effective mechanism that we've developed for that. I think our conclusions so far include the fact that the curriculum from the actual book, which I've taught many, many, many times, really translate very nicely and very effectively to the virtual platform. We've gotten great feedback, positive feedback. Again, there's hiccups, but we've been able to work around all of that. And it's also provided us with an increased use of technology. Like everyone who's on this webinar, I'm sure we've increased our technology use with Zoom and other platforms. And it's really giving our staff an opportunity to do so, but also individuals an opportunity to participate in technology and use of technology. It was really important to us that we were all able to continue somehow our health promotion programs and initiatives, even though we had to physically distance and be, sheltered in place. So this has allowed us to do exactly that. I think that my peers and Yasmina and Beth really see the opportunity for greater outreach within our own Aspire network for those people that we're supporting who don't live within our residential program. And I think as we plan for a return to day services, whatever that looks like and however we plan for that, virtual programming I think is here to stay for us in some form or fashion. So I think that's given us kind of an opportunity to view things differently. And I think also I'm really proud of the fact that we've just adapted. We've made this work. I know that we can. I knew that we could, but it's really given us the encouragement to continue to change to our ever-changing environment amongst the pandemic, and really helped us think outside the box for just other programs as we go forward, and definitely for virtual programming as we go forward. Okay, Yasmina?
Oh, you want me to cover this part?
Oh, I'm sorry. I forgot that I was going to do this one. No problem.
No.
Thanks for the reminder. It's me. Sorry, everybody. So as you think about getting started with health promotion programs or continuing, whatever that looks like currently at your organization, I mean, obviously we have to get buy-in from our management, our leadership, and our staff. So think about where you're at right now with kind of our world, and think about what, considerations need to be for staff time and what the expectations for staff are. Again, we kind of had two different scenarios. I had staff who were very well-versed to facilitate this, and then we had staff who had never taught it before. So we had to do a little bit of different work on both sides of that spectrum to get people prepared, and to let them know that we understood what they were currently doing to support individuals and how this was really going to be beneficial for the home and for the individual, and not just something else that we're asking them to do. So the way that you approach that, I think, is important to think about. We also really feel no matter what or who you are, it's important to create a team. So definitely at least 2 or 3 people that are going to be part of this team that can help, from organizing it to being a part of it to troubleshooting, like all that kind of stuff. Is important. And really also with technology and IT, we have to think about, do you have the right equipment? Well, how can people access the virtual platform in Google Docs? and really practice, provide time that's built into practice before the program even begins, and to help people, in the moment of logging in and using it too. I do think that we had not reluctance, but a little bit of uncertainty in the beginning, like, oh, how is this really going to work? Because people didn't have familiarity with using Google Docs. And really what we heard right from the beginning when they got on, it was like, oh, like this is great. We can figure this out. We understand how it moves, how it flows, and people had no problem once they literally tried it one time. So encourage, make sure there's that time to train people, to give them practice opportunities, and they can be comfortable with what they're facilitating through the program. Okay. Yasmina, is it you now?
Sure, I can take over.
Okay.
So before I kind of give you how you can get involved and utilize your Virtual Coach HealthMatters program in your organization, a couple of other things. It's important to kind of remember, we're not trying to inundate organizations or make it burdensome. We want to help out and do health promotion programming or for individuals with disabilities and improve the lives of individuals that we support. So really thinking, and we're just still kind of wondering out loud, thinking about if staff should go through the webinar training. It does take a whole day to do this, the training to become a certified instructor. I think, Kristen, do you want to comment your thoughts on this?
I'm sorry, can you repeat that, Yasmina?
Do you want to, just because Aspire has had sort of two different approaches to virtual, so what do you think is better? Just have people utilize the virtual training or virtual coach, or should they be certified to run the program?
I think it is helpful to be certified to run the program, and the way that it has happened this way with Aspire in the two different counties is we chose in Cook County, which had not yet implemented the program, to train certain staff who were going to be the facilitators of the program. So we trained the staff that we knew were going to run the program. COVID happened, and we then took our day program staff who are supporting our homes, right? So it just didn't match up for us. The facilitators weren't in the homes that we wanted to participate. So that's why the Cook County was done via remotely. I think it helps to have the training because it gives a wider background, if you will, of the importance of health promotion, and we kind of really give a good education about what the curriculum's all about. So I think it's always good to have that background.
And just to kind of add to that, we did have about a 45-minute virtual meeting where we showed the Google Classroom and instructed people, staff who were going to use it, how to get on, log on, and how to kind of navigate through it. But it took some time to figure it out. It took me some time to actually figure out how to make it as smooth as possible and sort of the cadence of each lesson online. Someone is asking, what is the cost to become certified in the program? Because we do have this grant for the next year, it is going to be free. So that is just hang on to for a second, and I'll explain that. So we really want to figure out, for those of you who have interest in this type of programming, how you can adapt HealthMatters program to your organization. So like thinking about your timing, thinking about which homes, thinking about which staff. So every environment is different, and we need to approach it in a different way. But we also have to make sure that we're not losing that sort of the integrity of the program, what we call fidelity of it. So that's something that we're really struggling with when we're trying to kind of adapt it to this new environment. And we also recognize that not everyone is going to be comfortable facilitating the program in this format. So maybe we can even think about different ways of doing it, not even utilize it. Maybe you can just use it with the curriculum. with the actual a book. So it's really important to kind of think about the training, your technological things that you need, and the preparation. Also important to create these touch-base points, and we've kind of talked about those. So get the feedback from staff immediately following the lessons, or when we meet, I meet with Aspire virtual as a Zoom meeting after completing each unit, and then we've even had some participants with disabilities join us and give feedback. So it's very inclusive to kind of figure out what really works and what people like and how they're going to benefit from this. So I'm getting questions about how to get involved. So let me just kind of give you a quick where we are with this. With this grant that we were awarded, we are looking for 50 community-based organizations. They're residential and or that offer residential or day programs. So with that, we would be able to offer free HealthMatters certified instructor webinar training. We would be able to offer free Virtual Coach HealthMatters program. And then we have the monies to spend limited funds, but we have the monies to spend the curriculum, the HealthMatters Exercise and Nutrition Health Education curriculum. So at this point, because we're still in these preliminary stages of really trying to kind of like scale it up and disseminate it, we wanted to just get the feel from today how many people are interested and just kind of thinking through in your organization how this would look. So I'm going to post this link to this. It's a quick questionnaire that it's a form that just asks some basic questions. Are you interested? Are you interested in the certified instructor training? How large is your organization? And those kinds of things. And then we're going to follow up. I'm going to just put the link to in the chat box right now. And then we really want to make it work with what you need and kind of how your organization is set up. So I'm just putting the link to the survey to how to contact us there. Kristen, do you have any other question? Do you have anything else to add? Or I wanted to open it to questions. We are recording the webinar. We're making everything, the PowerPoint and the recording available. Hopefully we can get it to you faster than a week. And then I will put the survey link, the participation interest form in that email too, so you can access it that way too. Kristen?
Yes, Mina. I do want
Yes.
to say that we through our pilot program, traditionally the program you run 3 times a week. We did ask our staff and individuals to do at least 2 lessons per week, and that seems to be working fairly well. But also do think about, I know that our programs and, again, our environments look very different these days. So this is totally an opportunity to utilize the virtual program and incorporate it and make it work into the structure of your week, your days that you're offering through your programming. So I think that, it can be incorporated in a variety of ways. And one thing is you can make it fit. You can definitely make this fit and work within your current programming that you're doing in your residential homes, in your virtual programming. It definitely can happen.
Thanks, Kristen. So this is the end of our presentation. I wanted to see if there are any questions that are specific to anything that we've covered. I am going to, like I said, we will share the recording. You will be emailed, and then I will put the link for the participation interest in it. And you can always directly contact me. I think you get emails from me at least once or twice a week. So I'm available to field any questions. So one of the questions is, would this be a good program for young adults still in high school with multiple disabilities? The program has been used in high schools or schools. we have not tested it in schools, but it certainly can be used. And, you know, Nikki, I can always show you the topics, and then you can make your decision. It is specific to people with intellectual disabilities, so it has been made fairly accessible to them. So yes, the short answer is yes. Could schools working with Project Search be part of your virtual training? The answer is yes. We can talk about that too. The goal is really to provide this training or this programming to anyone who really has interest. This is exciting. I will check in with our organization to see if there is enough interest. Great. Oh, thank you, Liz. Let's see. Is it appropriate for individuals who participate in adult services, or is it more appropriate to be delivered in a SILA setting? So far, we've done it in SILAs just because people have been socially or physically distancing and sheltering in place. But HealthMatters program is usually run in the adult day services or the programs. So the answer is yes on that. Let me see. I'm hoping I don't want to miss a question, so I apologize. How would this work towards individuals that are living independently with support staff? I think you can use it. It would work the same way as in a group home. So if they're more independent, they can even log on and be able to do their activities on their own. So it can be done individually as well. Let's see. Any other questions? Beth, I don't know. Will you be sharing the Google Classroom with us? So the short answer is no, it's locked. So it's not a free for all. You would have to be invited to become a student in the classroom, and that way we can kind of control who is in those classes. So there's no weird stuff happening. So I know that everyone. So it's a little bit more controlled, and you have our support throughout. So any others? Any other? I'm sorry, I'm reading. That's why I'm having. For Kristen, what has been surprising in doing this platform compared to previous work in day programs? Kristen.
So the question was, what has been surprising about the virtual program?
Yes.
I don't know if it's surprising, but I really think the enthusiasm that we've seen from staff and from individuals, I think there really has been like excitement about the opportunity to kind of be part of a pilot and to be able to, you know, help us develop and you know, adapt the program as it's needed. I wasn't expecting any kind of like, you know, not flack, but I wasn't expecting any kind of negative feedback from staff, but we really didn't hear anything that was negative or has been negative. People have been interested in continuing to want to participate in the program.
So just to clarify, some people are saying, is the Google Classroom free? Right now it is free for the next year, our program. And then someone asked about will there be other data collection for us to do? The only, and this is something, that's why we're a little bit like, let's talk about this. The only thing that we will be collecting is basically kind of what worked, what didn't, almost like an exit interview, asking staff and people who are using the virtual coach to give us more feedback so we can improve it. Some of it is basics. Did it improve knowledge? Did it improve confidence to exercise? And those kinds of things. Beth, did you want to elaborate on that? Okay, Beth says, no, I'm good. Okay. So let's see, someone said, do I have an example of Google Classroom on YouTube? So let me just try again and share so I can show you how it looks. So bear with me. I'm going to share my screen again so you can kind of see it again. Okay, hopefully, Kristen, can you guys see it? I hope so.
Yes.
So this is, just to go back to classes, this is kind of the beginning, and when I enroll you in one of the classes, you will just have one visible, and it's going to be called something like HealthMatters Program, and then you will click on this section, which is classwork, and then this is where all the lessons are, and they're divided in 5 units. So there's a little blurb about what Unit 1 is, and then obviously you would be getting more training during the Certified Instructor webinar training. When we talk about different units, you would be getting more information about that and get more familiar with the curriculum. That way it would be easier for you to use the Google Classroom, since we will be showing you how to use the curriculum. And then so there's lessons are divided in different topics, and these mirror the lessons that are in the curriculum, in our published curriculum. And I will just go to, again, lesson 23, because that one doesn't have comments, and for privacy reasons, I want to keep the comments out for now. So there's an activity. I usually have 1 or 2 health education activities. Some of them have a video, some of them have like visual like knowledge questions and those kinds of things. And then there is a let's move section, which is an exercise section to the classroom. And then do this last, basically this is the evaluation section. You're telling me what you liked about that lesson and how to make it better.
Yes, Nina?
Yes.
So I was just asked if individuals seem more engaged with the virtual program than I've experienced, in our day program, in our environment, just using the health education curriculum. And I think my immediate response would be yes and no, but mostly yes. I think the virtual program offers new and different and engaging visuals and images, and then the videos that Yasmina has found for exercise or any kind of component of a lesson. I think that has been really engaging. I do know that we have one house who kind of has to break it apart a little bit more, right? So they might do the lesson at one point in the day, and then later in the day or the next day they might come back and do the actual activity, because that particular house found that doing it all at once, there wasn't the attention or the ability to focus, so that they've kind of broken it up how it works best for them. I know another house in Cook County, we were having not an issue, but individuals weren't really engaged. And so we kind of had to brainstorm and figure out what were they interested in, how could we use those interests to kind of re-engage them. But I think that the virtual offers just some different dynamics and ways to do things than the actual, curriculum book. They can definitely go hand in hand, and we're using the resources hand in hand. But I do think the virtual has been more engaging.
There are some couple of really good accessibility questions. Are the activities descriptive for people with vision loss? And then what about persons with hearing impairments or who are deaf? What are the accommodations in the curriculum? So the second question, the videos have closed captioning. So that's one for people who are deaf or hard of hearing. With the activities descriptive for people with vision loss, it's usually, and correct me if I'm wrong, how you guys do it, oftentimes the staff will be reading the questions and describing the pictures, if there are any pictures. The videos are just the videos may not have descriptions for the vision loss. because they're outside of our Health Matters. We have not created them. I have found them from different places. So but that's a really good accessibility question. And Kristen, did you want to add anything to that?
So I don't have anything else to add to what you said, Yasmina.
Okay. Have we included people with physical disabilities in the exercise routines and in the curriculum? Now, we've used some videos. Actually, we've used some Special Olympics videos, and we've used some the videos that are aimed at people with mobility issues, such as wheelchair users, et cetera. So yes, the answer is yes. Not all of them are, but I really try to get these videos as resources that can be done from a chair or any kind of adaptation. And this is, for example, working with us. Like Kristen is great at adapting some of the exercises. So Kristen, do you even want to talk about, like in the beginning, we've had some issues with videos, and you were able to talk to your homes to be able, just kind of mention some of those. So some of the, Yasmina we found some good resources through Special Olympics. They have some exercise videos, and they also come with, it's called, I think, Fit 5 or something like that. I can't remember exactly what it's called, Yasmina, but they also have cards, like visual cards that you can print off to support the videos. So we did share that with through one of the lessons with the houses, and some of those things individuals weren't able to do just based on modality or physical movement. So we kind of took the exercises that were in the video and on the cards, and I just adapted them and gave suggestions for standing, sitting, kind of all kinds of ranges of ability, and just offered suggestions on the movement for that, and then shared that with our homes. That seemed to help support what they were looking for. So it's not perfect. It is truly a work in progress because it's just a different way of delivering information. One of the people, attendees was asking to clarify, is the program for staff or clients? It's for both. So when I talked about parts of the curriculum, there's 3 components of the Health Matters program. The first one is train-the-trainer certified instructor webinar training, and that's usually a day-long webinar training to certify you to run the 12-week program, and you utilize the curriculum book. And then the second is the 12-week program, which is aimed for individuals with intellectual disabilities, and that the 12-week program, the way it was tested was 3 times a week, 1.5 to 2 hours per day, so total 4 to 6 hours per week, just for staffing, sort of when you're thinking for planning. And then the components are in 36 lessons total, and the components are health education and physical activity pieces. So it's the staff that's taught how to facilitate a 12-week program using our Health Matters curriculum book, which you would be, if you decide to take advantage of this virtual program, you will be getting the book as well. Let's see, any other? Oh, thanks, Eva. Thank you.
Yasmina,
let's see.
I had another
yes.
question.
Yes.
I was asked, have people been motivated to focus more on physical activity and food because of COVID? And I think I've seen a little bit of that. I think it's going to depend on the house and the individuals and the staff who are participating. But I know that in one home in particular, they were specifically asking for more resources to talk more about nutrition and food. And we talked about, I brought them different ads from that I get in the mail for the different stores. They could kind of use some of that to have discussions or create collages, things like that. So I think that's going to be dependent on the individuals and the staff facilitating the information. But I have seen that.
And I just wanted to follow up. When Kristen is talking about it, it really, when you're thinking about this type of health promotion programming within an organization, it really involves multiple levels. It involves your administration, leadership, it involves your staff, and involves people with disabilities, and you have to get the buy-in on all three levels. And this is where this is what Beth and I have been doing for years and years, really trying to figure out ways to build capacity and really utilize what each organization has that's very unique to that organization, and to be able to implement this type of programming that has been tested and evidence-based. The question was, does the grant cover the cost of staff becoming certified instructors? Yes, we are going to offer, and I'm sorry, I'm speaking sometimes in a little bit of more vague terms because we have not figured out a protocol on all of these pieces. We are offering the certified instructor training for free. And the virtual classroom for free for at least this year. I think there was a question about what's the cost afterwards. I have the cost for our certified instructor training because we've been doing that for many years. The virtual classroom, I don't know that yet because we are just starting. We just want to support you now for this year. We may be able to find additional grants to keep it going for you. So I don't know. The answer is to be continued or stay tuned. So we are at the hour, so I don't want to keep everyone or anyone. Again, I will send the survey again and the PowerPoint and this recording. Thank you, everyone. We're going to stick around for a few minutes to see if there are any other questions. Again, you can always directly email me, and we can connect that way. Again, thank you for staying with us and attending this webinar. I just wanted to, oops, I forgot. Next week, don't forget, same time, shifting services in community-based organizations, meeting the needs of people with intellectual and developmental disabilities. We have Susan Silverman from Research and Evaluation at the National Council on Aging presenting with us. So thank you again. Have a great rest of the day, and we'll be in touch. Oh, Sabra, it's the link for if you're interested in learning more about how to get involved. Let me put it back up. Thank you, Sabra. All right. Thank you, Linda. Gil, can you email me? Gil, can we set something up tomorrow? I can't talk in an hour. I'm sorry. But email me. Okay, thanks, Gil. We can chat tomorrow for sure. All right, I'm not sure, Kristen, if there are any other questions.
Okay, I'm still here.
So, okay. Oh, thanks, Beth. I'm going to sign off. I'm going to shut it down.
Okay, thank you.
Thanks. We'll chat soon.
Sounds good.